Hi, this is Dr. Autumn Morales. I'm the pediatrician here at Clarinda Regional Health Center, and we are going to start a short series called the Pediatrician's Corner. And what we're going to do is talk about some common pediatric problems and conditions, and hopefully this will give you some information and inspire new ideas and new questions. Today we're going to talk about dyslexia. Dyslexia is actually a really common problem, and the reason I chose dyslexia is this is actually Dyslexia Awareness Month. So, definition of dyslexia is it's a common language processing disorder. A lot of people think of it as flipping letters backwards or switching letters around in words, and that's really not what it is. It's a brain disorder in that the brain doesn't process the language in a normal way. You can see so many different things with this problem. The most common is reading issue, but you'll see things in preschoolers even. Some common things you'll see preschool age is they often have a speech delay and have trouble saying the first sounds of the words. They'll often leave off like the very first syllable of the word. And you'll often see then that they have trouble learning new words or understanding words for things. For example, they'll use the word thing or stuff rather than giving you the actual name of an object. They often can't do rhyming games, so if you have a child who can't do like cat, bat, hat, that sort of thing, that's a concern at the late preschool age. In this early school age, as in like kindergarten, first grade, we'll start to see actual reading issues. They have trouble recognizing sight words, trouble recognizing the middle sounds of words. Sometimes by that age they've mastered the first sound, but the middle sounds may be really hard for them to understand, and they often leave off end sounds. For example, if there's a plural or a past tense like cats or jumped, they may just say cat or jump rather than give you the full word. And these kids often don't like to read aloud because they just aren't very good at reading yet. And I want to also say that dyslexia is a learning issue. It is not an intelligence issue. Just because you have a learning issue does not mean that the child's not intelligent. They may be quite gifted in other areas. For example, they may be gifted in sports. They may be gifted in mechanics or putting things together. They may be great at music or art or other things. It doesn't mean that they're not intelligent. It just means that they learn differently. So back to those other symptoms. Sorry, I got a little sidetracked. But what we see in that school-age child is, again, they have trouble with rhyming, and they have trouble doing sequences such as the months of the year or days of the week. Some kids even have trouble just singing the alphabet and remembering those sequences of the letters. Sometimes math is affected as well because, again, this is a true language and sound and word processing disorder. Typically they'll do better with counting than they will letters, but you can have math issues just like I said. As far as diagnosis, this is a really complicated disorder, and it's not just a simple diagnosis that your pediatrician is going to give you. This is something that it takes a lot of specialists and a lot of different type of testing. There are centers that do this. They're all over the country. Fortunately, we have some really good centers in both Omaha, Des Moines, Kansas City, Iowa City, as far as local places for us. But these centers have a multifocal approach. They don't just have a pediatrician saying, yep, your child has dyslexia. It's a psychologist, a neurologist, speech pathologist, an audiologist, a visual impairment specialist. There are so many people involved in actual diagnosis. The child would actually undergo both intellectual testing as well as psychological testing, because with dyslexia we see common other problems such as ADHD. You can have anxiety, depression. These kids often have low self-esteem because they feel like they're not smart or they're not good at school, and it's maybe the case that they're not great at school, but it doesn't mean that they're not smart, and that's something I think you really have to talk to these kids about and continually work on their self-esteem. One thing I'll say is that their brain learns differently, but it doesn't mean they're not smart, and that's how I'll put it to young children. But back to the testing, they do this multifocal approach, and the earlier the better, because if you're going to do some intervention, the earlier you can intervene, the better the child typically does. Once they've already tried to learn these sight words or learn how to read on their own, it's hard sometimes to go back and relearn new techniques. But if you get these young children like kindergarten, first grade, before they really have mastered reading, it's a great time to start intervening. And again, that's a multifocal approach. It's got to take the teacher, it takes the parent, and typically using some other therapies. Like there's some great speech pathologists and great audiologists who have really good techniques. One example that I've got is I have a little guy who didn't read well, didn't know his sight words. But he's really into hunting and fishing, and his speech therapist came up with a great idea of shooting the sight words, and that was how he did it. He shot the sight words with a Nerf gun, and I'll be darned if he didn't learn those sight words after that. So great approaches are out there. We just have to look for them. But I will say it's really important for the parent to be the #1 advocate. If you have concerns about your child's learning, development, or anything, you need to bring it up with your pediatrician. And if you feel ignored, bring it up again. It's really important that you get your point across, because you know your child best. With that being said, I'm going to go ahead and end today's segment. If you do have questions about dyslexia, I'm happy to see you guys answer any questions, and I'm sure your pediatrician would do the same. There's also some great reading materials out there, and if you need any help with this, certainly you can go to the dyslexia organizations. There's a national organization for dyslexia. This is Autumn Morales. I'm a pediatrician here at Clarinda Regional Health Center, and I appreciate you listening today, and I hope you have a great day. Thanks.